Getting to that root cause is really important because in my humble experience, what I have found is that unexplained fertility at times has an explanation, and that explanation can be tracked with functional medicine.
This is going to be a fun episode. I'm really excited. I'm so grateful. So for the listeners here today, I've got Dr. Tali Kahan, a functional medicine practitioner with so much more to offer. So Tali, can you list everything, because I don't want to forget something?
Yeah, absolutely. Thank you, Danica. It's really a joy to be here. Really a pleasure, and I'm very excited to be here with you today. So yes, I'm a naturopathic medical doctor. I specialize in functional medicine, so everything from hormone imbalances to any kind of chronic complex case, something like an Epstein-Barr or any kind of viral component, as well as digestive challenges as well, and mental health. I also do energy healing and craniosacral, which is a big blessing. And that's pretty much the root of what I do. I love to ascertain what the root cause is and really work with that. So it's not as much sick care as much as it is well care.
Mm-hmm. I love that you said the mind-body component or the emotional piece, because a lot of functional medicine here in Los Angeles is, here, take these 35 supplements, which is really off-putting, which is why I want to say that up front at the beginning of this episode.
Yeah.
She's not one of those functional medicine practitioners that's all about the supplements. She is truly holistic.
Yeah, yes, definitely.
How did you get into this field?
That's a great question. So I wanted to be a psychologist, actually, for many years. And then I studied abroad in India. And in India, I lived on a farm and learned about the integration of body, mind, and spirit in healing. Then I lived in Oregon on an herbal farm, and I first met my first naturopathic medical doctor. Was very inspired. And then studied Ayurveda, herbalism, practiced both, then studied naturopathic medicine and energy healing. And that's what's found me here today.
Just so fascinating. I'm stuck with, you went to India and lived on a farm. What was that like?
Oh my gosh, amazing. It was really a joy. I learned so much about what it is like to not only go slow and listen to both the land, develop community, and kind of be in harmony with nature and with spirituality in a really embodied way. But I also learned how people that have very little are so joyful and so healthy in their soul, and how that actually implements and moves throughout their whole body and creates healing.
Right. The healthy mind informs the healthy body.
Exactly.
And that is actually how we started talking, thinking we should film an episode, because we were talking about the types of people that we see and in the fertility space, and how that rooted in fear is working against them. So, I mean, we can come back to that, and we will, but I love that you mentioned when we have less, or some of the people that you worked with in India having less, but having more joy, and for you to work with the land. So of all of those things, how do you decide when you have a patient in front of you where to start? Like, is it just different? Is it different with each case? How do you have a knowing of this one needs functional medicine and maybe supplements, or this one I should start on craniosacral to access their energetic body?
It's a really fun question. And the truth is, I say a prayer for every patient before they come in, that they're well.
And they don't even know that.
Yeah. Just that good intention, I think, is so important, and trust in their body's innate healing capacity, which every single person has. And as you said before, like, it's that faith. That faith is really what allows for the healing to occur. It's not me doing the healing. It's not even them. It's the healing that moves through me and moves through them. And that actually is the beauty there. I always work with functional medicine first. That's mostly what people come to me for as a doctor. But occasionally I do energetic healing or cranio as well. And I love to integrate, like, the beautiful work that you do, acupuncture and, therapy, and just many different modalities and the healing space, and specifically with fertility. So when it comes to something like fertility, which for a really good reason, a lot of women can have perhaps a fear story about, And I think that's very common. It's really restoring the faith and restoring function simultaneously that is absolutely instrumental in the healing journey.
Mm-hmm. Repairing and recovering faith that's been lost from failed attempts,
Yes.
and the function of the ovaries, the pituitary gland, the hypothalamus, cortisol levels, right?
Exactly.
I know you have the scientific lingo. So for the listeners out there, it is so not woo medicine happening. It's the interplay of the practitioner with the patient. And I think I want to talk about the word frequency healing, as we're emitting a frequency all day long of wherever you're at psychologically, subconsciously in that moment, like the frequency of, I don't have enough time, I don't have enough eggs, it's not going to work, or something that's working against themselves. So that frequency, what's your take on it as really it's really reflecting the progressiveness of holistic medicine right now, and we are helping them change their frequency.
That's really beautiful, because I think that it's not coming from a place of lack. It's actually coming from a place of having that faith and having that frequency, even though there is so much reason perhaps to go against that due to experience, failed attempts, and just kind of that stress around it, which I deeply relate to and understand.
But from the electromagnetic field perspective, right, we are emitting something. And as we have that frequency coming off of us, it's, what do you feel it sensitive like I do?
Yes, definitely.
And then what do you acknowledge and mention to the patient? Do you realize that you're emitting this kind of frequency?
I do pick up on it, and I definitely relate to that experience that you're having too, Danica, because I think that, as a sensitive being and also someone who studied energetic medicine, I really do feel. But I actually have found that in my experience, and I'm curious of your perspective as well, when I embody the frequency, there's actually an opportunity to create spaciousness for the other person to have whatever frequency they have, and then just orient back to the light, or orient back to a frequency that feels more resonant. And that's really my mission when I come in, is to none of this like energetic guarding, but just to embody through my own vessel, through my own experience, both on an energetic plane, but also on a very physical plane. So, I can do the scientific jargon and the lingo. I have lots of experience in this, and I'm very available for that, especially when a patient feels aligned with that. It's not how I orient in myself, but I know how to translate between the two different communications and worlds. And I think that it's necessary to understand that everything is energy, and also even scientific matters that are very Western in nature are very energetic as well.
Oh my gosh, you just said like 3 different things I want to speak on, but I love how you just expand your own frequency to be a frequency of everything is fine. We're here to heal. We're here to transform. And then that patient gets enveloped in your frequency, and then it changes theirs.
Exactly.
Because I think we're really at a time in human evolution where the word frequency or progressive medicine is new, but getting popular quickly. And people like us that interface with them and their medical doctors in a field where they're getting so much scientific jargon and fear consciousness from social media, talking about how hard it is to get pregnant and stay pregnant. All of that is loud. It's a loud, noisy frequency that can really take them down. So I hope that anybody hearing this will start opening their mind to this very real thing that's going on as far as healing, as far as healthcare is concerned. And a lot of the testing that you do in functional medicine is beyond the basic complete blood count, right?
Yes, definitely.
It's nuancy.
Very nuanced.
So let's shift gears into some of that scientific speak for a minute, and give me an idea of what types of things you can test for and why a patient would want to do some kind of comprehensive functional medicine testing?
That is
Big
such a fun
question.
question.
It's a big question.
It's a big question. It's a big question, but my mind went so many fun places. There is so much that we test within functional medicine. So much. Yes, of course, we can do a basic CBC and look at very simple blood markers. But we also test for something like ferritin, which would not only look at anemia, but would look for anemia that is specifically looking at storage iron, looking at any kind of inflammatory component. We look at everything from SIBO, so small intestinal bacterial overgrowth, with the breath test, to a stool test. And the root of all medicine, in my humble perspective, the root tends to be in the gut. The gut is really the seat of all health and all disease. So when the gut is really healthy, the body with time can heal.
Where do we put the emotions in there, though? Because the gut and how we feel about things are so connected, right?
Yes.
I say the vagina is the second brain, but a lot of people would argue that the stomach, the gut, the microbiome is the second brain.
Absolutely. So I think that for women and men, it's a little bit different. But for women, I think that there are two brains besides the actual brain. One is definitely the stomach, and one is, I would say, also potentially the uterus.
The
uterus.
I say the uterus is the second heart.
The second heart. I love that.
But the vagina is the second brain in that, sexual trauma is stored in there, and the patients have to work through some of that sometimes in becoming pregnant, or actually in giving birth. To open the birth canal to get past 3 centimeters is something I've seen when there's trauma. Anyway, I didn't mean to derail you. So
not at all.
In these
right
testing, so the gut, the microbiome, the second brain, or the place in our body that informs our immune system and our nervous system.
So 80% of the serotonin in the body is in the gut. And the mucosal barrier is very instrumental to immune functioning. So when I'm looking at, for instance, something like an Epstein-Barr virus, or I'm looking at strep or any kind of bacterial infection as well in the gut, that can have a very large impact on mucosal functioning, on immune system functioning. And that can be revealed through a stool test. I'm not talking about a colonoscopy or an endoscopy. I'm talking specifically about taking stool and then looking at what bacteria are higher, what bacteria are lower, and looking specifically at that kind of healthy bacteria and where the balance is. If there's any parasites, any kind of leaky gut, like zonulin, and looking at these other functional lab markers that are specific for revealing kind of the health of the gut, and in turn that emotional tapestry and that mood, the balance, the well-being.
Right, because I think where I was wanting to go with my comment is when we don't feel good, we typically don't make good choices when we eat, right? Or if we're processing a lot of stress, we're going to eat to support ourselves in the moment only, like choosing fatty foods because our adrenals are weak and shot and tired, or choosing sugar or caffeine or stimulants to just like power through.
Exactly.
Right? And then how that affects the integrity of the gut wall.
Yes,
and
that
what
inflammation.
You're saying.
Yeah, exactly. So when women are experiencing stress and their cortisol goes up, maybe during the luteal phase for some women, if there's a PMS or PMDD component, which is very common, or during something like, rounds of IVF that have not yet succeeded but will. God willing. Those drinks.
Right.
God willing.
We know, it's patients, they work as hard as they can. And then when they surrender, oftentimes giving it up to higher power can be a shift. And yet it's hard to get there sometimes.
Absolutely. And support can be needed.
So in the day-to-day, the way that you're supporting fertility patients, let's just start with cortisol.
Absolutely.
Because this is Los Angeles, busy city, crowded fertility clinics. And life is stressful. Maybe they're not getting a whole lot of good sleep.
Yes.
And maybe they're not supporting themselves so good. So what types of tests would you order? Let's make it like the average fertility patient, like age 37.
Absolutely. So the average fertility patient, age 37, we're looking at day 3 and day 21 hormones. So we're looking at progesterone, estradiol, testosterone, so all the sex hormones. In addition, we're looking at basic blood levels, so like CBC, CMP, lipid panel, looking at if there is any kind of inflammation as well. So looking at CRP as well. If there is any potential mold exposure, or if there is any potential small intestinal bacterial overgrowth, bloating, gas, etc., then we do more specialty labs in addition. And kind of getting to that root cause is really important, because in my humble experience, what I have found is that unexplained fertility at times has an explanation, and that explanation can be tracked with functional medicine. So therefore, it's extremely important and very wise to go ahead and look into a deeper dive. And for me personally, I practice very one-on-one medicine. So I love to understand what's really in a person's history, in a person's heart, in a person's medical needs and background that would be worth testing and reflecting. But I definitely always do day 3 and day 21 labs. Sometimes we do a Dutch test as well, which is a more in-depth hormone analysis.
From the urine.
Yeah, from the urine. Yeah, exactly.
Is the Dutch test checking more of adrenals or reproductive hormones? Both?
Yeah. So there's different kinds of Dutch tests, but one of them also checks cortisol levels. And cortisol has such a huge impact on everything in the body, from weight gain to stressors in the body, impacts hormones. So there's something called the cortisol steal. So basically when cortisol goes up, sex hormones go down. It literally
I feel like you should say that again, because that just affects fertility in all caps.
Yes.
When cortisol level is high, reproductive hormones go down, which that affects the uterine lining in a patient who has a lining that won't proliferate to do a transfer. Can be because the stress hormone cortisol is up too high. And what were we joking about? People have become so practiced at living in high cortisol levels, right?
Exactly.
It's familiar to us. We actually think we're thriving when we have
go, 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 go.
Yeah.
Yeah. And the truth is that less is always more. Always more. A little bit of the right things. It's talking about the supplements, also lifestyle. But what I have found is, a woman's coming in 20s, early 30s with unexplained fertility. There's often, almost always, a cortisol picture involved.
Tell me more.
Absolutely. So it's usually the kind of women, and I think we were chatting about this too, that are very high achieving, very much wanting to do the best, and have a little bit of that beautiful perfectionism that becomes a little bit too active, and that leads to overdoing many things in their life and actually underdoing the things that are really important in creating life, which is rest and relaxation, parasympathetic, feeling safe in the body. That is actually really the key here, is that energetic component. And if there is any other cortisol related challenge, like a hormone imbalance or any kind of impact on digestive system as well as a result of cortisol going up, and that having an impact on the gut microbiome, because that can impact healthy bacteria and an imbalance in the gut microbiome as well. So really supporting cortisol is really instrumental.
Where does progesterone come into cortisol? Because I'm thinking there's so many patients here in Los Angeles struggling with endometriosis or wondering if they have it, and if so, how should they go about treating it? But endo being this imbalance between, or just like a combination of, is it progesterone insufficiency? Is it inflammation? Is it coming from the gut? Is it from embryological tissue that's not been differentiated? Like cortisol levels and progesterone, I think what I've seen is a lot of women in the luteal phase, second half of their cycle, or after they've done an embryo transfer, the progesterone seems to make them more agitated a lot of the times.
Yes. So progesterone is a very beautiful and very interesting hormone. So progesterone has an impact on GABA, and GABA is that relaxation neurotransmitter, exactly. And when progesterone is very low, it's hard for a woman to feel that feeling of relaxation. I have seen for some women, they don't respond well to supplemental progesterone. It's something that can happen, and it can have to do partially with the breakdown of the progesterone. There could be other reasons.
A burden to liver, maybe?
Yeah, potentially. I think.
I'm just thinking about the endometriosis cases where it seems like estrogen dominant, so they don't have enough progesterone to keep that estrogen in check, as maybe another factor going on there.
Absolutely, yeah.
But they are probably lacking in GABA. They get very stressed out very easily.
Exactly.
So how can they start to improve their response to progesterone, or are there foods they can eat that might make the gut more responsive to, or their liver more receptive to the progesterone?
Most women tend to have a positive response to the right amount of progesterone that is balanced and in harmony with their cycle. I think it's a little bit different when one is supplementing for an IVF procedure, et cetera. And then certainly when there's an excess of hormones supporting liver functioning, supporting gut functioning, kind of getting that foundation really steady beforehand is super important. So kind of building up the body for the the welcoming in a new life is
right. It's the work we do that's preparing them before they get to a transfer,
exactly,
or before they get to an IVF protocol in the first place. So I want the listeners to know, when they are preparing themselves hormonally, one of the ways that we are improving the liver, and I don't mean Chinese liver, I mean like the actual liver organ, to make it optimally receptive to the different hormones that are going to be coming at them, it's cleansing through the large intestine, right?
Exactly. Yes.
You want to talk about that?
Yes, I would love to. And I also wanted to circle back about the endometriosis, because it was so beautiful what you said. So,
well, those go together.
They do go together. Absolutely. What I have found is when I'm working with any kind of hormone challenge, I always like to work specifically with the gut first, because the liver and the gut are very interrelated organs that work together. So the large intestine really needs to be in prime shape for the liver to be able to also be in prime shape. And that interrelationship is really crucial. So I almost always run a gut microbiome test with most people, because I have found that really is the root cause of many different challenges. When it comes to something like an endometriosis, I have seen vast majority of people come in with elevated estrogen, but sometimes I don't, which is always really interesting. So it's kind of like really what's going on there if it's not always elevated estrogen. And I think that there could be several components here. It could be cortisol, for sure. That has a huge impact. It could also be, this might be a little bit radical. Okay. So bear with me.
Yeah, I can take it.
You can take it. Okay. An autoimmune component as well.
Certainly. It's definitely, I like to say endo is a boundaries issue, but that's also like self-attacking self. And not expressing a good boundary with other people necessarily, like saying yes to piling on responsibilities when really she needs to say no and relax, recharge. So where were you going to go with it? Because I 100% agree. There's definitely, when all of that wreckage is going on with pelvic inflammation, it's sending out inflammatory markers, and the body's system and nervous systems reacting and responding to that chaos. That definitely turns up the sensitivity in the immune system. So I don't think you're going too rogue, but I definitely want to hear more from your brain about it.
Yeah. So for me, when I'm looking at an endometriosis case, I'm thinking to myself, what's actually the root cause of the endometriosis? What's really going on there? Not what the labs are saying, but what the labs may have said if I would have seen the patient 2, 3, 5 years ago. So what's really that root cause? And once I get to that root cause, really targeting, is there potentially a concomitant autoimmune condition going on as well, healing that autoimmune condition in addition to supporting estrogen, progesterone metabolism and balance. And so really every single, whether that's polycystic ovarian syndrome, whether that's anxiety, whether that's endometriosis, really getting to that root cause of the condition itself, healing that is really, I think, the key for each patient. And within each patient, every condition can look so different, especially in collaboration with, their whole picture. So it's really thinking of, for instance, like one of my favorite herbs, turmeric. What a beautiful herb. It's so incredible. It's just, it works on so many different things and it's so helpful. And I've seen people really thrive with it. And the question is, when is it appropriate? When is it the right herb? I love it for endometriosis. I love it for any kind of, painful menstruation, dysmenorrhea, any kind of viral challenge. High dose turmeric is very gentle. I love gentle medicine. Gentle medicine is really where it's at, because when you work gently with the body, you heal the root, then the body can have a healing response rather than me doing the healing or the patient doing the healing. It's creating the right vessel for the healing to occur, which means knowing the right dosage, the right supplementation, the right medication when necessary, and also the right testing. Definitely the right testing too.
I'm hearing my patients listening in the audience and they're saying, but gentle medicine sounds like it would be slow going and I just don't have that much time. What would you say?
It's a fun question. It's fun. Yes. Yes, absolutely. I have seen gentle medicine heal much more quickly than aggressive therapies, especially when gentle medicine is targeted and accurate, like when you hit the bullseye.
Right, because we may feel like on a toxic measurement, we are way over here, like it's feeling so toxic because maybe we're bloated or whatever, having menstrual pain. But to just knock ourselves back into our balanced range doesn't necessarily take a whole lot. We're just really sensitive. And if we go back to what you were saying about autoimmune, I just want to, for the listeners' sake, what would you be screening for in your autoimmune? Is it like anti-ovarian antibodies, anti-endometrial antibodies?
Yeah, so I look at anti-ovarian antibodies. I also look at things like thyroid
anti-thyroid antibodies.
Exactly. I also look at ANA, so general screening, and if we need to dive deeper, we do. Those are kind of some of the basic things.
ANA for the listeners is anti-nucleic
antibodies, I think.
Yeah, so that kind of generalized, but just ruling out if there's an autoimmune thing to treat is part of optimizing for fertility from a holistic standpoint.
There's so many different reasons that unexplained infertility actually has an explanation when you get to the root. There's usually some kind of underlying reason that just has not had the chance to be looked at, addressed, and ascertained yet. But when you do look at that root cause and you do heal it, the body can heal. And the body can heal in the way that it's meant to, supposed to, and gives an opportunity for those next steps.
Well, I think unexplained comes from the Western doctors part of the team in that, well, we've done the standard IVF procedures and we've used the standard toolbox of reproductive medications and we've done it 5 times and it's not working. Therefore, you get the diagnosis of unexplained. But that is the domain where medicine like this is very beautiful and powerful and game-changing.
It is. Yeah. And I know that you've been, Danica, in this field for a little while.
Decades.
Oh, it's amazing. And, just have seen so many different people thrive and seen so many people
change.
Yeah.
Run with some suggestions and transform their lives for the better.
Wow. Yeah.
Yeah. There's something to be said for patient empowerment.
Absolutely.
And that is another thing that's at the root. The process of going through IVF and fertility, I think, can be very scary and disempowering.
Oh, for sure.
So to help the patients feel more in control of an out of control process is wildly important. It's what gets me up in the morning.
Yes.
Literally. It's never the same patient twice in the thousands of patients that I've worked with and helped. So, you know, it's helping them to feel less broken, helping them to know that they're not the only one. And more than anything, I want them to know that this is just part of humans' evolution.
Definitely.
We're not conceiving the same way that we used to because technology is here, or because the industrialization of our food, or the environmental toxins, or the exposures a high amount of cortisol in our bloodstream, and the perception that we are somehow in danger.
Yes.
Exactly. Those things are loud, but acupuncture in particular, with its exposure to endorphins, is really like the domino push. And the way I set it up is probably similar to you. We're talking in the rooms. So oxytocin, bonding hormone through conversation, serotonin of feeling like everything's going to be okay. That starts flooding the bloodstream, and the endorphins. And when we get that trifecta of good neurohormones into the bloodstream, then the patients start feeling more inspired to make changes and implement things that we talk about. And that's where the magic happens.
Definitely. Yeah, it's that relationship. It's that feeling of safety and that feeling of trust and that feeling of empowerment that is so important.
And what does it do to cortisol levels? What do you think?
Right. Goes on down.
Right. And it drops that. And then the parasympathetic nervous system, like you were explaining, can kick in and work better.
Yeah, exactly. That's so powerful and so beautiful.
Why don't we give a little breakdown in how, because this is what we were talking about that made me excited to record with you. The differences that we see between like teen girls and millennials, and then women in their reproductive age and into perimenopause. Testing's got to be different for all four groups.
Totally different.
But they could all be listening, all four age groups, to this episode. So I know I've got a teen girl, and acne is something that she struggles with, and regular cycles. So for listeners out there with that, what do you test for?
So for something like acne and irregular cycles, I always look at the gut. The root of the skin has to do with the liver and the gut. So looking at like a SIBO test, stool test, looking at liver enzymes, also looking at hormones as well. So how hormones are changing. And for teenage girls, something like diet is really important, really instrumental in kind of getting that foundational building blocks is really great. And then sleep as well. So those are some of the things I look at for teens. And then for millennials, thinking more, screening for things like polycystic ovarian syndrome, looking at PMS, dysmenorrhea, so kind of painful cycles, or PMDD, which is PMS's a stronger stepsister, to say it like that.
Tell me how you screen for PCOS.
Polycystic ovarian syndrome. So the ACOG guidelines, kind of the standard of care, looks at things like testosterone and ultrasound to check for cysts on the ovaries.
So having them come from their OB with the report that they're seeing those secondary follicles not rupturing. But in the blood test, you're looking for elevated testosterone at any point of the cycle, or is it a special kind of testosterone that you're looking for in the labs?
Yeah, I'm looking at testosterone.
Free testosterone, or what is it, DHT? What's the difference? Do you know?
Free and total testosterone is usually what I'm looking for. I don't usually test for DHT. It's not something I've tested for in the past. And then I'm also looking for
DHEA.
Yeah, DHEA I always test for as well. Yeah. And then specifically hirsutism as well. So things like facial hair and other kinds of androgynous
outward signs.
Outward signs, exactly. So usually having 2 out of 3 is how you would test for PCOS. And then looking also for if there is any kind of other exposure to toxins like mold in the environment or any other kind of chronic complex case, that can be really informative as well. And then, thinking about more the perimenopausal transitions, thinking of how to support hormones during that time is really important. A lot of women are thinking more about supporting weight as they go through perimenopause and menopause, and kind of supporting sleep and insomnia and those sorts of things too.
Sure.
Yeah.
Well, I'm thinking about how many people are drinking Diet Coke or Diet Pepsi and thinking that they're doing something right for their weight.
Oh, for sure.
Please, can you say something about that?
Yeah. So, I think we live in a culture where there's a lot of good and bad when it comes to food. And I will always tell patients, I never see good and bad in food, but I will see food that will be more salubrious to your health and food that will that will cause more challenge.
What does that mean?
It's my favorite word. It just means health giving.
Oh, okay.
Yeah. Health giving, or foods that will kind of cause more of a challenge for health. Diet Coke, Diet Pepsi, even frozen healthy meals, they can be helpful from a weight perspective potentially, but they can increase things like inflammation. They can increase the toxic burden in the system. They can impact the gut. And frozen foods, even ones that are organic, that have lower nutrients, they have to be thawed out afterwards. Having fresh whole foods, ideally from, local, seasonal, grass-fed beef, higher in omegas, wild-caught salmon, things that are whole food, kind of like a grandmother medicine, I would say, is really where it's at, and trying to eat in a way to balance blood sugar. Blood sugar, I think, is often underlooked in women's health and hormonal challenges, and in cortisol, and especially in a culture that finds it so important to think and chat about healthy and balanced weight, which I agree with. Part of that story and that narrative ought to be talking about how can we balance blood sugar? How can we eat regular healthy snacks and meals to kind of, to balance the body's innate need to have that feeling of relaxation, safety, satiety, and to balance the hormones in the system so we're not constantly in fight or flight.
Right. The Diet Coke in particular has like NutraSweet, aspartame. Those, I think, are neurotoxins, right?
Yeah, exactly.
So they're very addictive too. And in my case, fertility patients are extremely compliant. And if I say, that's one thing you could let go of and put in substitutes, even an iced tea or something that is cold and refreshing. There's so many different like mineral waters and different beverages now more than ever.
Yes.
It's easy enough to create a substitute, but I know that there has been a correlation with having the Diet Coke and then having weight gain and thinking, but I'm just having this innocent drink.
Yeah.
Why am I putting on all this weight? And I don't know what it does to the fat cells, if anything, but as we bring more awareness to this idea of better food options and the importance that food plays on the role it has and the impact on our hormones, the better. And certainly having a Diet Coke, if it's 0 calories, but it's 100% chemicals. And they're not chemicals that naturally occur in food. Yeah. So that's sort of like linking it back to what you're saying. And I know you will agree. The more that you eat food that is, quote, real or as close from farm to table, minimally processed, the better you feel, the less you actually need to consume.
Absolutely. Yeah. The more you're getting whole foods,
you're getting nutrients.
You actually need less. And anything that has an impact on a feeling of lower satiety, but higher kind of sweetness aspect, like you're talking about Diet Coke or a Diet Pepsi, can certainly create an addictive cycle. And that addictive cycle can actually create a higher craving for sugar, and sugar in itself. They've done research with animals, and they've seen how they literally will reach towards it much like any other addiction. So kind of having this understanding that, full choice, full freedom And also, this is kind of the impact, allows people to make really wise decisions about what's best for their hormones and their fertility, coming from a place of agency. Like when I engage in consuming this food, not all calories are the same. Not all sugar, from different kinds of artificial sweeteners are going to be the same. Understanding that is really important. So if, some people have qualms about stevia, which I very much understand, but I will say if I'm to choose between a Diet Coke, a Diet Pepsi, and any kind of stevia-based drink, I would certainly favor the stevia.
I know there's just so much confusion and manipulation around food and marketing of food. But that is a whole other episode, and I did do that already with a dietitian. And since I cut you off where you were talking about you got through the PCO stage of women, what would a consultation look like if she's trying to conceive and maybe a few supplements that you would recommend or that you see yourself recommending on a regular basis?
Absolutely. So I have several different kinds of consults. The first is usually just a basic intro call. It's just an opportunity for meet and greet people to get to know me, how I practice, and for me to get to know them. And that's really a beautiful opportunity for us to just kind of dive in, see if we're a good fit to work together. And oftentimes we are, but just to kind of get to know. And then from there, we do, the initial intake. And the initial intake is a deep dive into their entire health history and all of their treatment goals. So that's a really comprehensive medical intake. That first is just kind of a deep dive where we get a chat about everything that's going on, from their hormones to their birth history to where they see themselves in 20 years with health, really everything under the sun. And then from there, we do an in-depth analysis of all of their labs. And all those labs are really informative and very, very helpful in determining next steps. So we do functional lab testing. So we do specialty labs and then serum labs. And for a functional medicine provider like myself, I look in a lot of depth at the kind of labs that someone else might look at. And I look at them within a certain range, and it helps me ascertain exactly what's going on in a different way that I can read it than maybe someone else might look at it. So it's kind of the functional medicine perspective. And then from there, there's a follow-up, and that follow-up allows us to actually begin treatment, which is really sweet. And when it comes to fertility specifically, I'm looking at what their entire fertility journey has been like. We're looking a lot at how they're tracking their cycle. We're really getting to the root cause of where the unexplained infertility or the explained infertility is coming from. And then we do functional lab testing. And then from that functional lab testing, we ascertain what needs to be worked on, what needs to be healed. Is there any kind of vitamins that are lower, nutrients that are lower, hormones that are imbalanced, any kind of other condition going on that needs to be supported. And then from there, we go ahead and treat that root cause together. And that can take anywhere between, depending on the person, a month to 6 months. It can be a range. And especially when it comes to, preparing for something like conceiving, or even something like egg freezing, or something, as like IVF, etc. We want to work on things as soon as possible. We need at least a couple of months to really start to see changes in the system. So I love a quick fix. And I think that sometimes that actually can be what the body can have. There can always be a quick healing that can occur. And sometimes it needs a little bit longer, and the body is the wisest decider on that.
And it's important for patients to remember that they don't get to chronic health problems overnight. It takes a while to get as out of balance and toxic or burdened liver as some of us can be, or we get really practiced at being upregulated in stress. And so to take 1, 2, or 3 months time to learn how to employ mind-body techniques, practice acupuncture, do some exercise, different kinds of awareness promoting activities to learn how to self-regulate or get the blood sugar in balance and optimizing. It's time well spent.
Very well spent. And it actually is more effective in the long run.
Right. I think this is a fun place to say that improving my fertility when I had finished acupuncture school took me 5 years, 6 really, to optimize. And then I was able to conceive 2 kids with 1 natural attempt only. But that was 5 years, that's 60 cycles. Granted, that was a lot of time, and I did it starting when I was like 31, 32. But I spent those 5 years really looking at the emotions and some behaviors and choices I was making, and diet and mindset and the role of spirituality, all of that holistic stuff before it was a thing to do. Now there's a ton of people that can support the patients in that pathway.
Yeah, exactly. It's so inspiring to hear your story, and just to hear how much consciousness and mindfulness really went into conceiving for you.
Right. So as we wrap up the interview, Dr. Tali,
yes,
what's something you might want to leave these listeners with about how you practice, your thoughts on fertility in particular?
Yeah. So how I practice is very much based in a Western paradigm. It's very much logical. It's very scientific in nature, but it's also very embodied and very intuitive and very spiritual. That integration, I think, is really important, because the body always has the capacity to heal. And in addition to that, looking from a Western perspective, basic lab markers that not everybody has the opportunity to get to look at. So things like the more detailed, in-depth analysis of vitamins, of hormones, of root cause medicine from a naturopathic perspective is, I think, what makes my practice beautiful, a gift, and a little bit different.
The work that we put into improving our fertility is the starting point for the children that come from a body that has had that loving extra care.
Yeah, right? Exactly. Yeah, it's that in utero development and that kind of foundational lead up.
And then the way that they learn how to improve their fertility informs how they feed their children.
Yeah,
so
absolutely.
This is that epigenetics, how, right, like small changes right now are having big impacts on the offspring.
Yes. Yes,
so
they are.
The more we make a shift towards greater health, really screening and looking at things that we can fix and take care of before becoming pregnant, is going to improve the life of that child.
It definitely will. And having that foundational, healthy, nourishing environment to be born into is going to absolutely have that impact. Yeah, when it comes specifically also to fertility, I think what makes my perspective very unique is that I'm looking at all the other factors, everything else that is contributing to the fertility picture. So looking at really that root cause with the functional lab testing is really needed, and unfortunately is not done enough. And there's really an opportunity for that to be done now.
So patients that want to work with you or are curious to learn more, how do they find you?
Absolutely. So they can find me in a few places. They can find me on my website. So it's DOCTOR, Dr. Talia, TALIA.com, or through my Instagram, which is Dr Tali, TALI, Kahan, KAHAN, or you can just give the office a call, 310-909-7054, any of those 3 ways, and you'll be able to find me.
Awesome. What a beautiful conversation. And I feel like we kind of covered everything that we have been wanting to say, to share, right? So thank you so much. I know you're super busy. I appreciate you making the time, and I know the listeners do too.
Thank you so much, Danica. It was a joy to be here.
It's a lot of fun to talk to you.
I'm so grateful. Same. Yeah.